welcome everyone. I'm really happy to see faces. Although Sylvia, we don't see you. Oh, we do see you now. Okay, good. You know, it's a funny thing. Welcome to the webinar on movement building for system change and health equity. It's a funny thing because I'm just getting used to doing the webinars with video on. I've done lots of webinars now in my NCCDH time, but I'm just getting used to seeing myself on video while this happens, but I actually really love it. And you know, if others in the audience would like to video share and be visible, they can. Just know that we are recording it. So if that's a concern for anybody, then that is that. We do have some polling questions that are planned for the conversation today. So if you can go to Slido, which is the link that's there, type in the code 672059, and that will allow you to participate in the polls and in the polling questions. It's also the only way that you'll be able to see any responses come in live as if you connect to Slido. So that's important to know if you like to watch kind of what's going on. I think this conversation will be really exciting. It's meant to be a little bit informal. I like the less formal type of presentations that we've been doing the past few. There's a few little slides, but I like that it's a conversation, and these two ladies are extremely knowledgeable and talented and very, very exciting information, very stimulating. So I've been really looking forward to this. Now, Danielle, can I switch my own slide or can you do that for me? There we go. So obviously my little bit of discomfort with this platform is showing right off the bat. So we have two speakers today. We have Megan Gatos, who is a project director at Human Impact Partners, which is US based, and Sylvia Chu, who's consulting director of collective impact at Tamarack Institute. And when we were conceptualizing this webinar and this conversation, I said, you know, there are two organizations that need to be part of this, because they're the two organizations that I go to when I think about intersectoral work and movement building as a bigger intersectoral approach to health equity. And this was it. So I didn't want to do this conversation without these two specifically. So I'm just really excited that you're here. You're hearing me, Diane Weichel. I'm a knowledge translation specialist with NCCDH, and in the background is our ultra-talented research assistant, Danielle McDonald, who's pulling the technological strings, and we couldn't do this without her. So thanks, Danielle. Yay! And now I'll ask you to switch the slide because I don't know how to do that. So, oh wait, no, back up. There, I guess there isn't one. So, before we go any further, and I guess actually we won't have another slide after this, Danielle, unless our speakers share. So before we go any further though, I do want to acknowledge with thanks and with gratitude that we are speaking to you from Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq and Maliseet people. And NCCDH is located in Mi'kmaq, also known as Antigonish in Nova Scotia. And we're at beautiful St. FX University. And the thing about land acknowledgements for me, and we've been doing them now a little while as very regular practice, and we often hear about them, or we often hear them now as part of regular conferences and events. And I think it's really important to reflect on what we've learned and what we do when it comes to reconciliation and understanding Indigenous health and colonization and history. So one of the things that I have been doing and will continue to do is forming relationships with people in the Mi'kmaq communities right around where I live. And that may sound a little bit obvious, but when I think about reconciliation, relationships are at the heart of reconciliation. And as I've formed relationships in my personal life and in my work life, it's really helped me to learn about the impact of colonization, the impact of residential schools, the inequities that happen. And so I'm trying intentionally to put myself in that uncomfortable space I'm a white woman, I'm not Indigenous, and I don't know what that lived expertise is like, but I'm committed to learning and trying to address it and do something a little bit more. So with that, I am going to ask our speakers to introduce themselves. Megan, can you maybe go first?
Hi, everybody. My name is Megan Gatos, and Diane, thank you for that. We are also exploring the process of sort of doing more land acknowledgement and how do we weave the horrific history that has happened to Native folks in the land into the work that we're doing, and we still have a lot to learn. I'd like to begin by acknowledging that the United States was built on and continues to occupy land stolen from the Indigenous peoples who were its original stewards. I'm here today in Denver. I'm new to Denver. I moved here a few months ago, and I'm learning that it's on the traditional and ancestral homelands of the Arapaho, the Cheyenne, and the Ute nations and peoples. And I'm also learning that this is also where I'm in is a rich place of trade, gathering, and healing for many other Native tribes. At the same time, over the past 175 years, we've learned that Colorado has been the site of genocide, forced removal, and forced assimilation of Indigenous people at the hands of the US government and white settlers. And I want to personally acknowledge I'm a white descendant whose ancestors came to the United States in the last century on stolen land, what's now Ohio, Pennsylvania, and New Hampshire. And I've also lived in California, and I've lived in Mexico City. And there's so much to learn about each of those very different places and the common parallels across in terms of what does genocide look like, what centuries of white supremacy look like across those, and how is that manifesting into the health and lives of Black, Indigenous, and people of color communities today in Colorado, in all the places that I have lived in the past. And my hope is that by acknowledging and continuing to learn about these truths, we can all take action towards a healthier, more just future. I will stop there.
Nice. Thank you. Thank you very much. Sylvia?
Yes, good afternoon, everybody. I am joining you from Caledon, Ontario, Canada, which, as I put in the chat box, is the traditional territory of the Mississaugas of the New Credit First Nation, and it's home to Anishinaabeg, Huron-Wendat, Haudenosaunee, and Métis peoples. Interestingly, I am a multiracial Canadian woman. I have Chinese, Nicaraguan, and Celtic heritage, and I am on a continuing learning journey about the wisdom and gifts of our Indigenous people and, you know, the historic suppression and cultural genocide of First Nations people in our country. And really being thoughtful about
okay, can you hear me now? Oh, okay. I unmuted in the Skype, but then the little thingy.
Laura, can you mute, please? Thank you.
I keep being muted. It seems like there's a something in the meeting. Anyways, let's try this. So I say I'm excited. We got an abstract accepted for an oral presentation.
So Laura,
so that's definitely something to look forward to. So I'm going to stop there before this thing's. See, it keeps muting me. Okay, I am done anyway. So thank you.
So keep going, Sylvia.
I think that was the perfect timing. I'm on a journey, a continuous learning journey about harnessing the wisdom and knowledge of our First Nations people and integrating it as part of the truth and reconciliation process into the way we all live our lives.
Nice. Thanks very much. And thanks to everybody for being present with us through that conversation. So with that, I think we'll get started. And when we talk about movement building for health equity and a system approach to that, I think about the importance of engaging with community members, and so and people who have lived expertise of inequities. And so it's nice that we've opened with talking about our Indigenous communities, because I think that's an important one to engage and to think about as we talk about this. So, the three of us, as we put this conversation together, it started out, for me, it started out as a conversation about, okay, how do we actually take some meaningful collective action around health equity. And, I had said to both of these guys, I'm a frontline practitioner, and, all my years in public health, I think public health is really good at lining up the ducks, is how I put it. We're really good at, identifying who are the intersectoral partners, who might be organizations and people that we need to be involved around health equity work. We're really good at calling coalitions, calling meetings, putting together groups. But there's something that doesn't always get captured when we think of our work as an intersectoral approach. And so as I got reading about movement building, social movements, and how all that relates to health equity, that's kind of what led us here. And that's, a bit why we asked some of the registration questions of our participants that we did. And so I want to thank you also for the answers that you sent. It really helped inform the discussion today, and we're actually going to share a bit of it with you at the end as well. So if you can go to Slido, I think I'd like to start with our first poll. And we want to ask you a question. And that is, when you work at, I gotta go to Slido myself. In one word, what do you think of when you hear that term movement building? So type one word in here and press send, and then we'll see what people think. Because I think when, as I've evolved in my understanding of it, and this is a little bit what we're going to talk about after we get responses, I initially thought it means social movements, exclusively, but yeah, it's my understanding's evolved. So I think people are pulling in. Are they, Danielle?
I'm sorry, what was that, Diane?
Oh, sorry, I'm not seeing anything on my screen, so right. I'm wondering if people are doing it, that's all.
Yep, so we have comments about social change, power building, activism, diverse collaboration, systems change, anger, social justice, momentum, people power, revolution, connections, organic, those types of things.
Nice. Nice. So then I guess to my speakers, that'll help inform what we're talking about here. What does it actually mean to take a sorry, what does the concept of movement building for health equity actually mean to you and to the work that you are doing? Sylvia or Megan?
I can get us started maybe.
Sure.
I think for me, one of the most powerful sort of distinctions between a programmatic solution and a systems change solution, I think is a good starting place to open up what do I mean, or what comes to mind for me when I think about systems level change. And the definition that resonates most deeply with me is one that Karen Pittman, the co-founder of the Forum for Youth Investment, shared a few years ago with us, which is that a program intervention helps people to beat the odds, but a systemic intervention seeks to change the odds for everyone. So I love that because it shows for me how, the programmatic work that we do builds a foundation and helps to a degree, but the systems change piece is the other dimension. And I'm also sort of anchored in the definition created by Social Innovation Generation Canada. And they talk about systems change is about shifting the conditions that hold a problem in place. And what I really take from that description is that sense that we are, whether we intend it or not, we are not diverse, separate from the system. And in fact, some of our own behaviors and actions may be contributing to holding that issue that we seek so desperately to change in place. And so being aware of and owning that is important as well. So that's what I'll kind of put on the table to get us started, maybe.
Well, that's good. Megan, did you?
I'd love to add into that, because I think before we get to that concept of what is movement building, what Sylvia was touching upon is really helpful about what do we mean by a systems level approach to achieve health equity. I'm a very visual person, so I'm going to share my slides because that really helps me think through, visualize things. And I realized that I didn't say in my introduction about who I am. I work for an organization called Human Impact Partners, and we basically have 4 different strategies: advocacy, organizing, capacity building, and action-oriented research. And through that, we seek to transform the field of public health to center equity and build collective power with social justice movements. And so, Dan, I appreciated you noting the difference between like what are social justice movements and what is movement building, and I hope we get into that a little bit more. But naming that we work on these different areas, but we're really trying to mobilize the field of public health here in the United States. So for me, fundamental to definitions of what are we doing is a definition of like what is health equity. And I think all of us who are coming to this call are coming from a health lens, some sort of health analysis. In Human Impact Partners, we define health equity as being able to achieve all the things that are above, and that health inequities are driven by power imbalances and structural oppression, which are leading to the things that are below. I won't spend a lot of time going through them, but we really do center a lot on structural oppression and racism. And when we're thinking about a systems level approach, I really appreciate the work of the Racial Equity Institute, which is based out of North Carolina. And they have this analogy called the groundwater analysis, which is basically, they tell a little story about how there's like a little fish that is in a pond and all of a sudden gets sick. And then the people who are in that pond, it's a health pond, are looking at, oh, there's multiple fish that are getting sick and what are we doing? And so they start trying to identify, can we fix the fish? Can we like bring the fish to the fish hospital? What can we do? And they keep trying to fix the fish, but as they're fixing the fish, they keep getting more sick. And then they realized that actually in the ponds nearby them, in the transportation pond, in the education pond, in the criminal justice pond, everybody is getting sick. And what they realized is that there's actually the groundwater is contaminated and it's infiltrating all of the ponds. And so when we're thinking of a systems analysis, I really like this analogy because it's basically like racism in the United States, and I think across the world, structural oppression. If we're using there's many different dimensions to how we talk about structural oppression, but structural oppression is at the underlying pinnings of how all these systems have been formed. In the United States, so much of our institutions have been built with this intentional exclusion of certain populations and privileging of other populations, and very often around racial lines, but there's also around gender lines, around class, around religious elements too. And so when we're thinking about systems approach, we're trying to see like, what are those inequities that are perpetuating in every single system? And in the United States, we actually have a term that's describing the same thing across every system. So in health, we call it health inequities. In education, we call it the achievement gap. Child welfare, we call it disproportionality, and so on. And so in every single system, you see that there's a term in the United States, I don't know if that's true for Canada, that talks about the racial inequities that happen, even if you're controlling for other factors. And so when we're thinking about systems approach, we have to be thinking about what's the foundation that's contaminated, broken, and needs to be addressed across all of the systems in order to be addressing those inequities.
You know, I really love that because, you know, in Canada, we often use the stream analogy, you know, downstream and midstream and upstream, and that concept that if you're downstream, you're rescuing something, you know, children who have fallen into the river upstream, and that you're rescuing them. A downstream approach is you're rescuing them from the river, and the further upstream you move, the more you're addressing those broader factors. But the analogy that you just had around fish and then the environment, that's really powerful, and that really speaks to that connection between, you know, our physical environments and our community and structural environments and our natural environments, and yeah, the importance of the land, even in thinking of our opening around colonialism and Indigenous health too. So that's really powerful to me. And I like to this conversation around structural oppression, because really it's all of those isms that are at the heart of the inequities that we see in health. And I think in public health, I think practitioners sometimes feel really like they don't know what to do about those big structural factors. Sylvia, did you want to comment? Oh, you're muted.
As I was listening, I was drawn to and remembering a slide that friends who we work with in Palm Beach, Florida have shared from their context, where, one of the things that they showed very clearly was that, health clinical care really only kind of represents about 10% of the pie in terms of impact on the determinants of someone's health. Physical environment is 10%, genes and biology 10%, but they guesstimate that health behaviors, so my individual choices have a 30% impact on that overall picture, and social and economic factors represent 40%. So in a way, for me, that I think, Megan, your comments really brought that to mind, right? It isn't just about, it isn't just about treating the individual. It is about asking ourselves, what environmentally and structurally are we doing or choosing not to do that is also impacting someone's health? And what in our actions are we willing to do to advance change in those areas at the foundational level, at the groundwater level, to build on your analogy?
No, I was muted. Go ahead, Megan.
If I forgot, sorry, I'm trying to navigate multiple technologies at the same time, but there's like 2 more slides that I wanted to show, if that's okay, that sort of build into that. And it's basically talking about like our history in the United States. So if you look at power imbalances and racial inequities, for 90% of the history of the United States, there was an intentional and explicit othering of certain populations and compared to others. There was an intentional exclusion, particularly of Black and Native populations, and then as Latinx and Asian Americans, and that still continues today in different forms. It's more subtle often. But when you think about, as we're trying to advance health equity, we have to be acknowledging and reconciling with the fact that 90% of the history of this country, if you start from a point of when the first Africans arrived in Virginia, 90% of the history of the United States has been with an intentional exclusion and an intentional giving of additional powers to some and exclusion from others. And then when we think about that in the context of COVID, it's another sort of powerful analogy thinking about groundwater. And Tamarack Jones is a leader in the United States, and she has a wonderful tale called The Gardener's Tale, which talks about racism in terms of gardening and about how if you have like depleted soils, and even if you're adding certain things, depending upon the history of the soil, certain flowers will not be able to bloom in the same way. And you use that as a metaphor for racism. You think about that in the context of the United States right now, of why certain communities, particularly Black communities, Indigenous communities, are so disproportionately impacted by COVID. It's because of all of the different ways in which these systems are intersecting and perpetuating the inequities, even across as we're trying to address this growing pandemic. So I'll stop there. Sorry.
That's, Megan, I'm thinking about when you and I spoke early on, one of the things you said to me is that power building is a strategy to achieve, right? And so that's really stuck with me. And we were talking about the difference between movement building and regular old intersectoral action. You said, so it's power building is different. Not the same thing as a policy campaign where everyone's focused on just one singular thing. It's really a strategy to achieve through growth and synergy. And the other thing you said is that power sharing is also about relationship building. And that's the part of what's different when it comes to movement building. building a movement presumes that you already have relationships. And often public health, for example, because my brain always goes to public health, often public health doesn't have relationships with those good, deep, meaningful relationships with those communities that experience the inequities. So that's really what I'm hearing is the piece, and that's an important for the systemic type of approach. Now, Sylvie, did you want to comment before I go to the next?
Yeah, the other thing that's really coming to mind for me, for those of you who haven't seen it, and I'm going to try and see if I can do something here to share my screen. I'm trying to get it so that you guys can see it as a presentation. Does that work?
Yeah.
This comes from the water of systems change. So done by, done through a lens of collective impact as a frame for advancing systems change. But what I really like about it is it kind of begins to differentiate between the different barriers that would contribute to a systemic situation, right? And the question we need to be asking ourselves is, what is it that we're doing, right, to hold that problem in place? But, policies, practices, resource flows, all of these are things that to one degree or another are within our realm of control. So the three at the top are the most explicit and visible, right? So these can often be tactics that we're advocating for through our campaigns. The importance of relationships and connections and awareness of social dynamics and power dynamics and asymmetry in power, I think is the semi-explicit stuff that can come into play. And it does show up, in fact, when we are choosing to work across sector and or bringing the voice of lived experience and living experience to the table. So really being mindful of some of that stuff, I think, is really important. And then, the last one is mental models. And it's really about, that's the attitude shift. That's the mindset shift that we're striving for. And Alec Mansky, a long-standing mentor and friend, often talks about how do we get our new way of doing things into the water supply, i.e. it just becomes the way that people who come after us think it's always happened and don't always necessarily recognize all the multitude of efforts that have contributed to us finding ourselves in a particular place.
This is such a nice transition into the discussion about what a system level approach really is. And we asked participants in registration to comment on what they wanted to learn about this topic, and that was one of the things that came out is what is the system level approach? What does that really mean? I think about when the three of us met a few weeks ago. In that conversation, two things came out around that for me. Movement building is important because it's no longer about a program to just bridge a gap, right? It's not just about a program to address a singular problem that bridges a gap in service, for example, or a gap in access or a gap of some sort. And that there's a difference between a program solution and a systemic solution. And so hence the system level approach. So if I'm understanding, really, when we talk about movement building, it's about, intersectoral work might be about a specific policy or a specific program to bridge a gap, but movement building is about looking at the system and changing the system to be into something different, transforming it into something different to achieve something better. So is that what that really means, to take a system level approach to health equity? What more can we say about that?
I think one of the things that really was highlighted for me in the comments that you just made is that it can be an assumption that we all have to be aligned and working on the same policy, or all aligned and working on, the same advocacy sort of campaign. And I think that certainly aligning and supporting these various efforts is important, but I also think sometimes change tips when we have a multitude of loosely connected strategies, if you like, being maybe advanced by a multitude of different voices that creates a bit of a cascade almost towards change. And part of what I really liked about that Water of Systems Change visual as well is, you know, it talks about things like how can we change policy? How can we change our practice? And so that to me is a reminder that not to always just be focusing outward in terms of what's the change we want to see happen in our community, but also how are we living the change and or bringing it to life in terms of looking inward, both as individuals, as organizations, and as communities.
Megan?
I would love to build on to that. Because seeing that triangle, Sylvia, if you don't mind putting it back up, I would love to, because I'd love to talk through it. When we're thinking about movement building, one of the things is like there's building power towards something. And human impact partners, we tend to use the Grassroots Policy Project framework of power, which are 3 faces of power. And in listening to you, Sylvia, talk about this, it made me realize that the 3 faces actually map right onto the 3 different levels that you're talking about. So one of the first phases of power is around power to win a specific election or decision. And it's like organizing people and resources for direct political action. So it's like controlling what are the policies, what are the practices, where is money flowing? The second layer is the power to set agenda. So building infrastructure to shape the political agenda of what's happening. And the third is the power to change and hold public narrative and shaping how we make meaning of the world and our place in it. And so in some ways, what we've heard is through our conversations, in some ways, this is actually the most powerful piece, which I think is it's like, what can we dream is possible? What's the other, and when we're talking about movement building, what is the vision that we're putting out there of what we want to be achieving and how we want to have that be different? And often, thinking about social justice movements, there's like the civil rights movement or the HIV/AIDS, or currently Black Lives Matter movement, or there's gun control movements. There's a vision of what people want to be achieving. But as Diane was saying, there's lots of many different strategies to get there. And I think, Sylvia, you're saying it's like, we can't all be doing the same thing. It's actually about everybody using their own place of power, wherever that is, whether it's the public health professionals bringing health data, or they're bringing their relationships to share power with community partners and lift up the community partners, whether there's pushing power onto elected officials. There's many different ways in which you can be building movement and building power, and it can't just be singular. And so that's very different from like an organization or a campaign that's trying to achieve one thing. Of movement is much broader and has like a broader vision and a broader goal, I think. So curious what other.
Well, we just had a really good comment come into the chat box from Marnie, and she said a system level approach is like fixing the leak at the source instead of cleaning the spot where the leak is happening. And if you don't fix the leak, you'll always be trying to clean the spot where the leak is happening, right? And you know, I live in an old farmhouse, and so there's leaks happening like that all the time, or you know, there's a little spot of mold growing in the bathroom, or so you're always trying to clean up the mess instead of actually addressing the root of where the leak is, right? And it's interesting because I'm starting to hear something what Megan said about you know, the work of the communities and lifting up those community organizations, you know, and there was a question that came in on the registration too about advocacy, and you know, what is is movement building like advocacy? And I think, you know, public health practitioners have a hard time sometimes with that word. I was just talking to a friend about this earlier. Are they able to do advocacy? Can they do advocacy? What is movement building? Is it activism? I'm not an activist. How do you do activism? It's not part of the public health role. And sort of resonating what these concepts mean for, you know, what we do when we go back to the office. You know, so after the webinar today, and you know, what do we want folks to do? And I remember again, you know, Megan, when we talked initially, like over a month ago, you had said to me, you know, the role of public health in movement building is working with those organizations to leverage power, leverage the health sector power, right? So how do we work with community organizations that will help them, but also help our mission of achieving health equity, for example. And you also said, and I put it in quotes, we are not going to become them, we're going to support them to help them achieve their goals, which, ideally then would also be, would contribute to our goals of achieving health equity. So I thought of those pieces, and when Danielle was summarizing the polling responses for me there earlier that I couldn't see, some people mentioned anger and some people mentioned power, and that made me also think about advocacy and activism as well. So putting it into actionable and doable practical actions for public health in this kind of conceptual conversation is important. Go ahead, Sylvia.
Things come up for me. One is this, for me, advocacy is a strategy and part of an aligned set of actions that help to advance lasting change. And I also think, but to really make that lasting change happen, we need, it isn't always everyone doing the same thing, right? It's more like there's no silver bullet. It's like there's silver buckshot, right? And different people are able to lead different pieces at different times. And I think that that's a really important component to think about, because we may not all 100% agree on where the North Star is, but if we're all kind of aligned on roughly the right trajectory, there are points in time when, alliances will form. And we don't always have to be the leader of a movement. We can look to aligning and lifting up and supporting, the work of others as part of that strategy. But I think for me, there's a couple of things that come to mind. One is I don't know if I'm going to try and see if I can find it, but it's a quote from someone. Here we go. Let's see if I can bring it up. Can you see this? If I pull it up this way. Oh, yeah. Not that one. Sorry, this one. From someone in the climate change sector, actually, that I believe systems shift most effectively when change is happening at multiple levels in some sort of loose congruence. Change can be held back when a preponderance of effort is focused at a single layer of the system, so like at the local level or at the national level, for example. And other layers are either frozen in place or actively working in the opposite direction, right? So I wonder, right? I wonder about kind of really mapping the landscape and seeing where, what else is going on that we can kind of build upon and amplify, and what's our unique contribution as a sector. And I think you touched on it a little bit, Diane, when you were talking about, it's to a certain extent, this is about relationship, right? And so where, as a sector, do you have credibility and do you have relationship? And how are you leveraging those channels to advance kind of the messaging and the solutioning, I guess, for lack of a better word, if that is a word, to advance those agendas.
And movement building is, or taking that movement building approach and having those relationships, that it allows a more flexible and nimble approach to something because of those relationships, because they're already there. I worked with a community developer in New Brunswick a couple of years ago, Heather Chase, and she said to me, you have to have those relationships before you need something from them. Have relationships for the sake of relationships before you feel like you need something from the community, for example, or from your partners, right? Because that's what will actually allow the synergy to happen.
I would love to add on to that, Diane. I think there's an element of understanding. An important part about understanding systemic oppression and structural oppression is understanding our own roles in it. And like, how will I, Megan, white, middle class, college educated, mother, cisgender, able with currently no physical disabilities, how will I benefit from my friends, my colleagues, my family members that are experiencing other forms of depression along their identity? And how does that actually benefit me? And I will say, like, personally, one of the ways is when I am in queer spaces, I feel so much more liberated to be fully myself and be okay than I do when I'm in like institutional spaces where I'm expected to be a certain way and perform a certain way. And I get nervous that I'm not going to speak up in a certain way. And so when we look at like white supremacy culture, if folks haven't seen that, that document, it's by Timo Okun, we can share it later. It's a wonderful document that talks about how has white supremacy culture gotten so embedded into like our organization or institutions and the culture and way in which we interact, and how could it be different? And some of the parts of naming, I as a mom benefit from the curb cuts that were put in there from the American Disabilities Act when my kids were in strollers and when I was on crutches. I benefited from those. I have benefited in many different ways from things that were geared towards those who are experiencing the most inequities, but yet it benefits everybody. It's not like an either or pie. It's actually a both and a multiplicative process. And so I think one of the things in terms of thinking of our own naming, why are we wanting to be involved in this, we have to really situate ourselves and why we personally, and then also the organization, what's our stake in it, and start from that place, and also allowing for a level of vulnerability and sharing and I'm sorry, I just realized I had a chocolate chip on my shirt. Speaking of vulnerability.
Real talk, right? It's real talk.
Yeah. But thinking about how do we change our relationships with other people, we have to also start with ourselves and be real about where we're at and what's our background and what's our experiences and where have we experienced challenges and conflict. And so I think I've seen a couple questions in the chat about how do we change our organizations, and that's part of that, is actually like being able to lean into those relationships and build a level of trust and a level of vulnerability to have conversations about the systemic inequities and how are those manifesting in ourselves and our personal lives, but also in our organization is a part of that.
So good. So go ahead, Sylvia, you go ahead.
I was just thinking, you know, this theme of the importance and power of relationships and trust in this work seems a bit paradoxical, right? When we're thinking about building a movement or shifting a system that is sort of, you know, controlled by so many people. And I was really inspired not long ago. There's a really interesting sort of initiative that's coming out of the Aspen Institute, and it's called Weave, the Social Fabric Project, which I thought was really interesting. And one of the things, I'm going to pull it up here because it really named for me one of that paradox, right, that we're all kind of sitting in a little bit, because relationships don't scale, right? So just because I'm a friend of Megan's or I'm a friend of Diane's doesn't mean I'm going to be friends with everyone in Colorado and everybody in Antigonish, right? And so how do you then go about the work of, you know, shifting a system or whatever? But what was helpful was they start making this distinction, well, relationships may not scale, but norms do. And so we can create a new emergent system or a shift in our dominant culture, and that act in and of itself is a new form of power, right? It creates this echo chamber almost. They call it a moral ecology that we build through our own individual actions. And I really resonated with you kind of emphasizing that personal role in this journey. And then people within this new norm that we're creating are then given millions of subtle nudges that aren't necessarily always overt, but together they kind of create a social pressure, which can be really good. But then I'm also mindful, because we keep coming back as well to really thinking about white supremacist culture. And so that's the reminder that culture change, systems change is agnostic. You know, sometimes it's happening for the good. Sometimes it's actually not happening for the good. Right? and it's dynamic because it's a living thing. So we could get this huge policy win, for example, and then 3 years later, you know, it's at risk. And so that's kind of that's the complexity, I think, for me of this work. And I think the programmatic stuff has been a lot easier.
Totally.
And it was the low-hanging fruit, right? And we're past, not that we're ever going to stop programs, I think, but you know, just putting a program in place is the easy stuff. There's a reason why we haven't always wanted to take on some of this bigger stuff.
Well, programs are tangible, right? Like here's a thing and you can take it and you can do it and you can implement it. And, you know, so I mean, I was a frontline practitioner for a long time and it's much easier to do that. And I think, you know, as health professionals working in public health, so I'm a dietitian, you know, and we're dietitians and nurses, you know, we're trained to deliver service to our community. We're trained to have solutions and we're trained to provide. You know, when it comes through in the language of our institutions, even, you know, we talk about our communities as clients. We talk about service delivery and service to a community rather than growing it with. So there's something there. And a really interesting comment got made in the chat box from Amelia. When you think about the capacity to lead movements, because vulnerable groups are systematically, just roll down, systematically oppressed, and it's advantage because they have to fight so many other battles with little resources. And so, you know, we're doing all this provision. Oh, I'm echoing. Yeah, so we're doing all this provision from a place of privilege. And, you know, I'm thinking about Megan's really wise comment about why it's so important to position ourselves. And, you know, we sometimes get questions from public health about, well, why do we need to do this self-reflective work when we have all this other stuff to do? But you know, doing that work, you know, positioning yourself as you know, for me, I'm a white, cisgendered, heterosexual, English-speaking woman. You know, I am hitting a lot of boxes of privilege. But knowing that and learning that has changed my perspective on the solutions of what we've done as well, right? So I'm glad Camilla brought that up. You know, an example of this is the rise to explicit hate speech during the Trump administration. So, you know, it is interesting, right, where people are coming from and thinking about the dominant power. And so, what does that mean then in terms of, you know, we've talked a lot about alliances and relationships and relationship building. So, you know, who are those essential relationships that we need to have in public health? Who are those that we need to have existing, meaningful, deep relationships with to do this health equity work?
I think that's a great question.
Really great question.
I do. And I think it depends. I think it depends on what your issue is. I think it depends on where your strengths already are. Like, you want to operate from a place of strength. So what is it? What is your contribution to this change? Might be kind of a nice place to root that question. But I also am thinking, you know, back to that comment about how change can sometimes needs to happen at different scales, right? And so for me, that's the cue when I'm thinking about a change. What needs to happen at our local community level? How might we align with other communities and try and advocate for or shift action at a provincial level? And or what's the role and what's possible when we kind of work toward a federal level? Like, there's certain places where each layer of the system or level of the system has an opportunity to make a meaningful contribution.
Say that again, Sylvia, sorry.
I think there's, in any major change process, right? I think there's always opportunities for different sectors and or different levels of the system, local, provincial, federal, to each play that loosely coherent role, right, around all advocating toward the same end. And I think, you know, for me, if I think about things like the long-standing battle to eradicate tobacco use in, you know, that was a public health victory. And it went on for many, many years. And it's, you know, it is international in scale and scope, but then there were still things that we required, you know, municipal bylaws to make possible. And so, you know, when I think about strength, I think about, you know, public health has a really long tradition of huge shifts around, you know, public hygiene and hand washing, or, you know, the tobacco piece, you know, the design of communities to help as a contribution to reducing obesity. All of these things, right? So I go to where, you know, as a sector, you've done a lot in your history, and what have been some of those component pieces, and what can we learn from a close look at, you know, what you've already achieved, and how might it inform, you know, this new issue that's long overdue for us to address around health disparities and health equity.
Megan, do you have thought?
Yeah, I appreciate that, Sylvia. I appreciate that because I think my response too is like, it's like how do we go back and look at these all critically? Like the public health wins, yes, they've been huge in terms of shifting the landscape, and health inequities, like people of color still are disproportionately experiencing all of those things. Like when you look at obesity, when you look at tobacco use, when you look at all those things, those are still, and so why is that? And what was it? What's happening? And I think that it lends itself back to that power analysis about like, what are the systems in place, or the institutions and the power, like the political landscape, what is happening where that keeps perpetuating? And in terms of, one of the things I had been thinking when we're thinking about movement building generally is like, what's my my experience with movement building and like my impressions of movement building. And when I was in elementary school and more in high school, I didn't learn about social movements. I learned about individual leaders. And I feel like it is and that is a huge part of the individualism in the United States. And I don't know what it's like in Canada because I've never lived there, but there is so much of a describing of social justice movements in the terms of like, who was the civil rights leader, the Malcolm X or the Martin Luther King, or the who, so and forth, that like was the speaker for that movement. And there were so many other people that were behind, that contributed to that movement and all of the changes that it happened. And it's often reduced by those in power that are teaching us our history, that it was like these people that were responsible for it. And so for us, as we're thinking, what is our role in public health? One of my challenges to myself is like, I need to go back and relearn history and relearn about how social changes happened. And one of the things that I'm doing right now, I share my screen again, is I'm reading this book by Alicia Garza, who's one of the founders of the Black Lives Movement. And I really recommend it. You can listen to it. I'm listening to on because reading is really hard in the time of COVID with being parented, blah, blah, blah. But I wanted to lift this up of some of the things that she had talked about. You cannot start a movement from a hashtag. Hashtags do not start movements, people do. Movements do not have official moments when they start and end, and there is never just one person who initiates them. And I cut it out, but the part of that other quote is like, if there's somebody who's telling you that one person initiated it, then they've never worked in organizing. And organizing is always the thing that is behind social movements happening. And that I put this tag here because there was so much discussion in the United States about, oh, the hashtag Black Lives Matter started this movement, and actually that's not true. The organizing had happened, like the hashtag came out, but over the course of a full year prior to it getting popularized, there was organizing, intentional relationship building and movement building among these Black leaders, these female Black leaders who were getting momentum behind, and it was not just a hashtag. And so I think on our end, I want to come back to like what is organizing and what is movement building. That organizing is so intersecting with that.
Yeah.
And so one of our things is to go and learn from our local grassroots organizers and learn from those elders who have been doing organizing for a very, very long time. Black Lives Matter movement has been doing phenomenal things, and there's not one single leader. There, by force, the three leaders, and by intentional leadership, the three women who sort of co-founded Black Lives Matter are intentionally naming how much that is like trying to counter the tendency of US media and the tendency of like the way systems are just focusing on them, and point to the many, many diverse groups that are involved in doing Black Lives Matter, that it's a movement, it's not just singular people. I'm trying to think, and so I also wanted to lift up Right to the City Alliance is one of the groups that we as an organization work really close with. So Dawn Phillips is the executive director. And I just want to say, when we're talking about health inequities, partnering with community organizers, and I want to be clear what community organizers are and how that's different from advocates or who are doing policy advocacy. When we're defining community organizing, those are folks who are working to build power in communities that are disproportionately impacted by inequities. And they are not going in there with an agenda. They're not going in there with an agenda of like, we want to build power so that you stop smoking. It's like going in to build power for them to identify what their own priorities are. And there may be a slant. It may be like, what are your priorities within housing? But they're choosing housing as an area because they already know that there's disproportionate impacts in that. Right to the City Alliance is doing organizing around housing, around evictions, around displacement, around gentrification. But they also do it with an intersectional analysis of acknowledging that like, or housing organizing is so related to like economic security and related to immigration policy and related to criminal justice policy and disability policy. And so we enter through one lens, but we understand that each of them influences the other pieces. And as we're talking about organizing, we're connecting to people about what is their lived experience and what are the real solutions that you want to be seeing change, and how can we advocate for those? And that is very different from policy and advocacy worlds, where we might come in. I worked for a policy advocacy. I wanted to show this one picture. Sorry, I'll stop in 1 second. But this was the first time ever doing what I thought was movement building. And I learned as advocacy and organizing. This is my, I'm the little person in here in the middle. I worked for Physicians for Human Rights, my first like full-time job after college as a medical student organizer. And my job was to organize medical students on the HIV/AIDS campaign. And I didn't really know what organizing was before doing that. And when I did it, I was like, my title was medical student organizer. And so I got a sense that this was our first HIV/AIDS advocacy day, where we brought 400 medical students to Washington, D.C. to lobby on Capitol. The thing that I learned as I was in the work is actually this was not being led by impacted communities. We were supported, like we were mobilizing the political power of all of these students in their white coats to say, we want you to take action. And so there was analysis of power on that, but that was not coming from disproportionately impacted communities. And if you look at the history of the HIV/AIDS movement, some of the most dramatic changes happened from the folks who were infected with HIV, gay communities that were speaking up and saying, we need treatment, we need people to be studying this, we need access to this. It also then got sort of over sensational, I don't know what the word is, but when they started commercializing it, and Oprah and Bono started selling things from the Red campaign to donate a certain percentage of that to, I don't know, like this is a question for the audience, is like, is that part of movement building? It got to mainstream. And so buying your thing that gives us a token, it was still, I think the important lesson in all of this is that you need to be centering the voices of the most impacted. In this, the voices of people today that are disproportionately impacted by HIV, still today in the United States, are women of color, folks that are sex workers, folks that are injection drug users. What are the reasons in which they are getting into those conditions and that living situation? How do we intervene for them well, how will that help benefit us all? How do we center their voices? Or those, if we're having a more international perspective, I did work in Uganda. How are we centering the voices of those that are disproportionately impacted in countries that their colonial history and imperialist history with the United States? How do we center those voices in the context of what our response should be? And so much of that starts with those relationships. Sorry, that was a very long.
No, it's good. And it's so interesting that I go back again to something you said to me that I said earlier, you know, we're not going to become them. We're going to support them to help them achieve their goals, right? So when I think about public health, you know, what's the public health role in all of that, right? You know, I put up, and thinking about, you know, that a lot of these movements or organizing are led by people in a privileged position, not by communities who are impacted. And it's done with the best of intent. But, you know, I was at a meeting 2 years ago. I know my friend Erica Phipps is on the line. And when we were at a retreat together, someone in the group said, you know, I hope that we can all just understand that we come to this with the best of intentions. And there was an Indigenous woman in the room, and she said, I do not assume best of intention with anybody because of her lived expertise bringing that to the group. And so, you know, I've become very cautious of that term. So I think as practitioners, again, we think, okay, no, but we meant really well. Yeah, but the people that we are trying to support and work with don't come from a place where best intentions have resulted in anything good for them. And so I also, I put a link to a resource in the chat box to something we just recently released on it's called Let's Talk Community Engagement. And it's really about how public health practitioners and organizations can do that work of drawing on the expertise of communities as part of engagement, but as part of movement building to inform their work. You know, how do we move past thinking of communities just as someone we deliver service to, but yet they actually should be the ones informing our work, informing our approaches, and informing our movements when it comes to health equity.
And you know, there's a tension that I'm feeling, and I'm trying to reconcile, because I resonate absolutely with what you've said. And Megan, you know, when you were talking about, you know, who were, you know, the history and how we've taught it's one brave leader or whoever, there's a beautiful YouTube clip about the story behind Rosa Parks, where you think she's an individual acting alone when she sat down on the bus, but actually they were very strategic as a movement in choosing who was going to be the person who was credited with taking that step. And she wasn't the first, but, you know, it was sort of like understanding the need to, if we're going to be successful, the need to kind of reach and touch the hearts of a magnitude of people, crossing all kinds of lines. And I know, you know, so, you know, the people who are most impacted and don't have a voice, yes, they need to be the ones leading the agenda. But as someone put in the chat box, paradoxically, they have the least power. And yet we keep looking to them from our place of privilege and expecting them to be the ones to take the first brave step. And it made me recall having a conversation with a network of different Indigenous folks, you know, shortly after the Truth and Reconciliation Commission had come out with its 94 recommendations. And, you know, people were really, myself included, really sincere about wanting to embrace and make these recommendations real. And asking an Indigenous friend, so what do you, like, what does this look like? Where do we start? How do we, you know, how do we move ahead? And I remember she looked at me and she said, well, you know, why do you keep asking us that we're the ones who are supposed to tell you what it's supposed to look like? You know, we're so busy trying to keep our lives moving forward in a constructive way. We don't have any more answers than you do necessarily. And I think that's the dilemma for me in some ways. How do we have these kinds of conversations? How do we go to community with an open enough agenda? And what happens if, you know, because public health or an organization, any organization gets funds and has accountabilities to levels of government or funders who are wanting them to deliver X, Y, Z. And then we walk into a community and we authentically engage them and they tell us, we don't want X, Y, Z, we want ABC. And then, you know, and so then where do we stand and how do we reconcile those tensions around lifting up those voices? What does it mean to be an ally? How do we, you know, do we push back? Because we think we are more aligned to the oppressed that we are working alongside, but in fact, our own parameters are set by others. And would we challenge those? And do we feel like we have the agency to challenge those if they're part of contributing to what's holding the problem in place? I think like that's, for me, those are the places of real tension and struggle around this kind of work. And that's all the more reason why I think kind of this notion of creating alliances across movements, so we're more nimble and so we're being really strategic, as in the Rosa Parks story. Okay, so you take the lead here because of this, this, and this, and we'll back you up, you know, this way. In this scenario, we're going to take the lead because we'll get a different kind of listening. And it's really important that we bring these folks alongside. I don't know.
I appreciate that, Sylvia. And it makes me think about something that's happened. We're working with a health department in New England, and they were just talking recently about how they've been doing work to look at vaccine equity and trying to like prioritize communities of color getting access to vaccines more quickly. And they recently had a meeting exactly where, like what you were saying, they came and said, well, we've done all these things. And the community was like, but we wanted these things. And they felt, the community felt even more disrespected and more like, it's sort of like the health department was being sort of paternalistic of being like, look at us, we're bringing these goodies to you. Don't you want them? And they were like, no, we don't want those goodies. We want to get this thing. And so in that, one of the things that through our conversation that was coming up is like, what are the skills of the people in the room to facilitate that conversation and to lean into conflict? Because conflict's always going to come and happen. And especially with all of the different like histories and expertise that people bring, there's always going to be conflict. So who has the skills in the room to be able to facilitate a conversation where you can lean into actually, what you just did really hurt me and made us feel disrespected. And the reaction of the health department is not to coil away and be like, oh, they didn't want anything, like we're not going to feel defensive, but rather for the facilitator help create a container to have a conversation about how can we do this differently? What is it that folks want? And one of the things that another element to that, so there's a facilitation is an important part, and then also a stepwise movement towards how are we sharing power and what are we moving towards? And I recently came to this, learned about this this document, which I recommend. It's called the Spectrum of Community Engagement to Ownership. And so when we're talking about partnering with communities that experience inequities, it's talking about how do we actually move towards sharing power. And this is parallel to like Arnstein's ladder of civic participation, if you've seen that, and the Institute IAPP, I can't remember what the acronym is, but there's like multiple places that have had things like this. The thing that I like about this table is it actually is talking about both like community engagement goals, how the message is to the community being heard, and some concrete examples of activities. So when we're thinking about being in our own institutions, how can we advocate that our institutions move from doing fact sheet delivery to doing memorandums of understanding with community-based organizations? How can we move from doing presentations to actually funding community organizing, or be doing citizen advisory committees or open planning forums with citizen polling? Like, how can we actually get more meaningful input and ideally actually be moving more towards community ownership of the projects and plans? It's interesting when you think about it in relationship to institutions, because I think and it's a whole different topic area, is like, what role do government agencies play or other institutions play in actually helping support getting who you defer to? And at what point do those government institutions become irrelevant? Because there's actually full community control. And I think our organization actually is coming from a place where we think government is important. It's an important sort of like mitigator of inequities and does play an important role. It has been attacked in the time of Trump, and very much sort of talked about the needs to sort of shrink it and make it go away. But we actually do see that there's a very important role that government plays in being able to sort of mitigate and redistribute resources and so forth. But at the same time, as we're advocating for government, we want to be very conscious of what is the government doing, what are the strategies that they're advocating for, and how are they centering those voices of most impacted communities and sharing power to get there.
You know, this really brings to mind for me is Alamansky's work around 6 patterns to spread your social innovation and his thinking about the 3 innovators. So, you know, when you were, you know, it's again, like you, he said, you know, he actually went back and looked at 100 years of Canadian history and said there was never any shortage of really great social change ideas, but not all of them caught fire and, you know, really became movements, but some of them did. And so he kind of went back, and his curiosity was more about the patterns. And one of the things that he kind of landed on was rarely, if ever, is there that single innovator responsible for a huge social shift. But in fact, it's almost always a partnership between 3 distinct types of innovators. And I'm just going to pull it up to anchor us a bit. You know, so he talks about, there's the disruptor, also known as the passionate amateur. They are the person that's motivated by love. It's my daughter. It's our grandchild. It's my community, right? So they are, and I love how he's written this, motivated by necessity and inspired by love, right? They are wanting to make powerful change happen, but they're not really of the dominant system or systems. They're powerless, much like, you know, a lot of the folks that are experiencing health inequities. And so it becomes very easy to dismiss them when they're working alone, right? And we can be well-intentioned, but we can sort of say, yeah, but they just don't understand how our system works. They just don't understand how hard and unrealistic it is, right, for us to give them what it is they say they want, because we're all caught up in the rules of how things are supposed to be. But if that innovator links up with the second kind of innovator, the bridging innovator, who is often like an intermediary organization or a funder or a social planning council, the bridger is really a critical player because A, they legitimize the disruptor. So they kind of say, listen, you're right on point. You're onto something. Your message needs to be heard. And I will help amplify it. I will take my relationships of credibility and I will validate you and open doors for you and broaden your reach and your credibility within my spheres of influence. But the other thing is that the bridger actually pushes the disruptor. What happened to your child is tragic, but now what we need to know is how many other children in this province does this affect? How many other, you know, so it's give us the story, yes, but also give us the data. You say you want change. What's the change you want to see? Like, be specific, be, you know. So I think they bring a rigor and a discipline to the disruptor that's really useful and helpful. And then the third, those two can kind of get a lot further on down the road in terms of a change agenda. But the real magic happens when they meet up with the third. The receptive innovator, that's the closet rebel within the organization, right? Who desperately wants to see change happen.
Yeah.
And in fact, they hold the lion's share of the resources. So like the disruptor and bridger might have an innovation grant, right? For $20,000 for 1 year, right? While the dominant system is holding like $20 million to hold the status quo, right? And so what happens is if they partner with that, the person inside the organization, then the capital and resources of that dominant system then start to flow in ways that lift up and are helping to sustain the change we want to see. But the receptor does a couple of things I think really well. One, they raise the issue and put it on the radar in-house. So they'll go around and they'll say, gee, I've been reading a lot in the paper about blah, 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 blah. Does our organization have a position on this? What would our position be? You know, I think we really ought to, blah, blah, blah. So they're kind of like getting everybody ready, getting people's listening kind of percolating. And then they meet in a coffee shop and they say to the other two, okay, so when you come to the board meeting, I want you to really buttonhole this person. These two people are going to be like stone-faced and you won't get a good read. But you know what? They are so behind you, 110%. So don't put your energy there. Go and work these two over. And frankly, the reservation they have with endorsing what you're asking for is this, this, and this. Yeah. So if you can be thinking about that before you come in, that's really helpful. Right. And it's that linking of arms between those three types of players that I think is a really interesting way to think about it as we think about building movements. Right. So yes, the disruptor might be the person with lived or living experience, the person whose voice has historically been quiet that we need to lift up, but they alone aren't going to be able to do it. And that what I liked about this framing is it says then we all have contributions we can make, and it's really thinking about at what levels, right?
And I love that, and actually it's feeding really well. We do have a few questions, so I think I'm gonna shift us into that, and I think we're already addressing some of what's being asked. There was a question a little while ago: how can we think about movement building when public health itself often replicates power structures? I think we've addressed that quite a bit. So whoever, it was anonymous, so whoever asked that, if we haven't, please restate it in the chat box and we'll go back at it. But when I think of this, I think about, you know, these innovator roles, right? I think about, you know, what Megan was saying around, you know, positioning ourselves, reflecting on who we are, the privilege that we come from. And then if we do that, that might change how we approach these issues around equity. I think engaging with communities that have that lived expertise of you know, what it's like day to day to live with the issues that we're talking about. But it is that tension that public health does, you know, replicate power structures. The system itself is colonial. We're all in the system that itself is colonial. So, you know.
But it does make me think, Diane, about the Our Kids Network in Halton, Ontario, right? I don't know how much you know about them, but they have advocated on behalf of their region that every child should be supported to thrive. And part of their creation as a network, not as an individual organization, was because they have 6 anchor partners that form the foundation of their network. One was public health. One was the municipal community services. They had representatives from both the public and the separate school boards, a developmental services agency, and the police. And what I loved about it is they created themselves intentionally as a network because they knew that there would at times be a municipal council that they as public health, or they as a school board, or they as community services would be accountable to and have to take their marching orders from. And sometimes, depending on the election results, that council may not be advocating for policies that actually supported what we know around the social determinants of health. And so in creating a network, they actually started doing a report card about what's the state of our children in this region and what's it going to take to enable all these young people to thrive. And that allowed them to create some distance between themselves, the formal organization, who couldn't necessarily speak out. But the moment they become part of a broader organization that's rooted in data, they can take reasoned positions and advocate for an environment that says we in this region value our children and are willing to invest in them above all. So I wonder about that as well.
Yep. And this is great.
Tension.
Yep, and this is great because someone else was asking for examples, and so I've plunked another one in there. Megan, have you got something that that you want to offer here?
I think I'll skip. I feel like there's a rich discussion. Yeah, I want to make sure that other questions get heard.
Yeah, no, that's good. And, you know, I think because one of the other questions was about examples of communities and groups that have had wins. So, you know, if you've got some examples of that, we can state them now, or if you can share some links or send them to me. And that's something that I can share with participants as well, because you know, I think people are wanting to see what does it look like in action. So Halton Kids Network is one, Living SJ, St. John, New Brunswick. That's one that I plunked in. That's another one, actually. Sylvia, you probably know that one a little bit, do you?
A lot of the poverty work out of Calgary, there was something around fares, right? Which mobilized lots of people around making public transportation affordable for folks in poverty. Yeah, lots and lots of examples.
And so one of the questions that came through too is from our friend Dr. Jenny Pope, who's calling to us from England. So we have some international folks here. And Jenny was, you know, asking, you know, there's lots of this great conceptual, innovative, creative work, but inequities keep widening, you know, and that systemic piece keeps widening. So why do we think that is? Is it values still haven't shifted? Is it political priorities haven't shifted? Is it, you know, what do we think?
I think that power still hasn't shifted, quite honestly. Like when you look at the United States, and I think there's parallels in other countries, you still see like the forms of power have just shifted. So in the United States, we don't have slavery anymore, but there's disproportionately number, like I think it's 1 of every 2 African-American men is likely to be incarcerated during the course of their life. And so it's shifted to some slavery to incarceration, mass incarceration as a form of control. And then all the consequences once one has been incarcerated, and it's harder to find housing, it's harder to find jobs, it's harder to find all these things. And then how that passes along to your children when you haven't been able to, if you were put into jail or prison because you were discriminated against because of the color of your skin, and then that leads to a claim. If we had differential, if power inequities had been remedies, we would not still have these class and racial inequities. So there's an element of like, how are we actually getting to the root cause? In the United States, a huge root cause is racism. And so how do we actually do reparations? How do we like center communities of color in every single decision making and in being mindful of the policies and practices that have been happening? It's a huge question, but that's my initial thought.
And then I thought about the example that you named earlier, Megan, about, you know, the Red Campaign and AIDS, right? And so there's this concept of greenwashing, right? Mm-hmm. So I can do one little thing and now I don't have to think about it anymore because I'm a good person because I did X, right? And that's something that is also kind of at play. I don't know that it's any one thing. That lack of awareness, lack of understanding, lack of knowing someone whose lived experience is so different from my own would be another example, I would suspect.
Yeah.
Diane, really quickly, you had asked the question and we moved on to this last question. I had wanted to just share like a couple concrete things when people are thinking about what can I do in my own organization.
Yes, please. Exactly where I wanted to go next, actually.
I wanted to share, this is our health equity guide website. And so this is a website we formed for predominantly for health departments, but it is transferable to other health professional organizations as we've seen other people take it and go up. And it's basically like what is required for advancing health equity. It includes 15 different strategic practices. And actually, let me, hold on. I'm going to just share really quickly to help you.
Yeah, this is perfect.
My actual, So there's one thing I would direct people to. We have something called Power Building Partnerships for Health, and that is basically building relationships with community organizers. So this is specific to the United States and to our small little cohort of folks, but I do recommend trying to build relationships. And at the bottom of this page, there are a number of different things that we have developed, including a survey of health departments about their collaborations with community organizers. So those are lessons learned from health or agencies that have been trying to collaborate, and what's worked, what hasn't, what topic areas have they done it on. There's also a number of different resources in terms of like where to begin and how to begin. The Health Equity Guide is another, oops, this is another website that's completely packed with resources. That here are the strategic practices that I was mentioning. That's probably very small. But within each of these strategic practices, if you're saying my organization does a lot with data, you could go on the Mobilize data, and it gives you some concrete actions to think about how to advance equity. And then it gives you case studies about other health agencies in the United States that have done that. And at the bottom, there's a whole bunch of resources. I think there's like 200 different resources. So you can search the resource database and it'll give you different tools of how to use that. I'm trying to, the other piece that I would love to highlight is just the importance of sort of allyship and that recentering process. And so I'm happy to send a link, if helpful, to some of the organizations that I've recently connected to that have like been helping me think about my personal sort of, what does it mean to be white? What does it mean to be female or cisgender female? And how am I taking action? So some of that is like the personal piece, but then there's also the parts around reflection.
That would be amazing. That would be amazing. And I put the link to the Health Equity Guide in the chat box. That's one of my favorite movement building tools for sure. And Sylvia, I know that Tamarack has some really awesome resources too. Did you want to take a minute to profile a couple here before we wrap up? Oh, and you're muted. It's all good.
I was actually just looking for a link because one of the things that one of the Indigenous communities that I've been doing a lot of work with over the last little while just recently shared was a guide to being an Indigenous ally. Oh. And the one that I was shared is from Montreal, but I realized there's one from Calgary as well, and there's a number of them. So I haven't had enough time to kind of dig in and really see what's unique and what is, you know, consistent across many of them. But it's something that was, I remember kind of bookmarking for myself saying, okay, I need to know more about this. I need to understand the act of being an ally. Mm-hmm. And, you know, when I'm thinking about the whole change, like building a movement for change, I'm mm-hmm. also thinking about, for me, where are the influential bystanders who haven't really been engaged into the fray? And sometimes when we think about, you know, making huge systemic change, it's tempting to go to the person or the group that is the most opposed. And this notion that if we can bring the most opposed on side, like that's somehow a bigger win. But in fact, I think, you know, who are those influential bystanders who, if they were presented with a compelling case and some clear actions to take, would probably be more likely to kind of align with us and support the kind of change we're calling for. And then, you know, that's a different kind of strategy, but it may be in some ways a more powerful and lasting one than taking, and not to say that it's an either or, because again, I don't think it is, because we do have to challenge racism when we see it. We do have to challenge oppression when we see it. Absolutely. But there's lots of folks who are just waiting to be tapped and would be willing to stand up and do their bit.
Mm-hmm. And maybe that's a role of public health, is to, you know, help identify who are those folks that are ready to stand up and are ready to do their bit, and how can public health give them that space, and how can they lift them up so that
I think, you know, public health is this beautiful bridge between community and the broader health system. You know, and the broader health system is, you know, in its design and its structure, got lots of inequities in it that start with data. My colleague Lisa Atagali is working with ICES right now on, you know, doing more equitable data in the health system to help better inform our decision making. And I think it'll be a multitude of these little, like, they're not insignificant actions, but these smaller shifts will create a cascade, I think, and contribute to a broader change over time. But if I were the person experiencing the inequity right now, I don't know that I would be that patient, to be honest, right?
I know. Listen, and with that, we actually have to end. We're past our time, believe it or not. It flew, and you know, we were able to get to most of the questions that came through. So I really appreciate that. I just want to say thank you for the time and the energy and the perspective. I especially appreciated having two different countries' perspectives here. You know, that Megan was able to bring the US perspective. Look at it, it's funny because I had a slide that had both of the highlighted Tamarack resources and also the Health Equity Guide from Human Impact Partners. I put a link in the chat box for Collective Impact 3.0, Sylvia, because
Thank you.
Well, it's my other favorite movement building type of tool, and it's been really instrumental in helping me think about shifting from a management approach to a movement building approach, and what the difference is in that. And that's a really, you know, people need to read that paper because it really outlines really well. I think public health does well on the management approach right now, but it outlines what we need to do to shift movement building. So anyway, I hope you get some good pickup from that. And ladies, I just I cannot thank you enough for this. I love that you were okay with an organic kind of fluid type of conversation, because it went in a complimented but not completely planned direction, but it was good. It was really great. And thank you everyone for joining us.